My name is Imaze Marian Davis. Welcome once again to Marian Footcare Podcast. And this is our first episode, everyone. So I have a shocker for you. I hope by now you've kind of already watched my introduction so you can get to know a little bit about myself, where I practice, my background, my credentials, and that will give you some confidence so that you can actually know that you can learn from this platform and you can see some exciting cases. For the doctors out there, thumbs up for all of you all, for all the great work that you do every day as a podiatrist. And for the residents and for the students, I welcome you all. And just come on this beautiful journey with me. And today I'm going to give you a case that we see quite often, but this one is, it's a big one. All right. So look up there and what you see there, a severe bunion deformity. Now, this is a big one. All right. This 86-year-old male came to my practice and told me that he has been suffering from this crossover toe deformity that we call it. This is like the worst bunion that you will get. I mean, these are the ones that you just feel for that patient and you're like, wow, how long have you been living with this for? This patient reported that they have not been able to wear any closed-toe shoe for a very long time. It runs in the family and he gets teased a lot. So you know what? He's just learned how to deal with it. It's very, very painful. Very uncomfortable. And again, just imagine this guy hasn't gone shoe shopping for any normal regular shoe because I believe he's like a size 15 as well. I mean, just imagine with that widening deformity, the bunion causes the forefoot to be so wide that you really have to have a very, very special shoe. But again, we are here to make a difference in this patient's life. That was the presentation of the patient. You can see the picture is both sides, but we tackled the left side first because that one seems to be quite severe. I went through the process of making sure this patient has excellent blood flow by doing circulation tests on the patient, took the x-rays, looked at the deformity, saw that we have deformity at the two major joints. That second toe is pretty much dislocated, does not have any articulation with the rest of the bone. So we have to bring that toe down and we have to work on that joint as well. And then you have the big toe, okay, at this first joint, which we call the first MPJ joint. That toe is, again, dislocated as well, literally falling off the joint. And the bunion on the side, you can see how prominent it is, rubbing in the shoes. So you can look at the x-rays so you can see how the deformity actually displays on the x-ray. And with that, we strategically plan out how we can use small incisions by bending and cutting the bones in specific areas to help to mold the foot back to a much better normal alignment. Okay, just to go a little bit more detail. So on the x-ray image, as you can see here, the joint has so much arthritis. Okay, it has so much arthritis and so much cystic nature in the bone. So when we look at the bone, you can see that this bone quality is also kind of questionable. Okay, especially at the head of the first metatarsal head and also at the head of the second metatarsal. When I say metatarsal, I'm talking about the big bone here, okay? And then also the head of the second metatarsal. And then you can see that the toe is not just deviated. It's not just leaning over, but it's also kind of rotated, okay? These are terrible deformities, all right? The toe is also rotated. So we have to not only just bring it over, we also have to kind of like rotate it back to its normal plane, okay? So now what did we plan out for this patient? So we plan on initially first resecting the prominence of the first metatarsal head, so the bunion pretty much. We're going to file that down. On the x-rays, you're going to see how the first metatarsal head was filed down. And then we make an osteotomy. Osteotomy means osteo means bone and osteotomy means cutting of the bone. So we're going to make a cut within the head of the bone, okay, to take that head and shift it over. All right. Traditionally, many years ago, I used to do open bunion surgery, where in this particular type of surgery, this particular type of advanced deformity, these patients are usually offered some kind of fusion, some kind of long incision where we do a cut at the base of the bone and move that whole deformity over. So the patients, sometimes they're happy, but again, they have that huge long scar and also increased chances of complications in the future. But in this particular case, you get to see that actually just keeping things very, very simple. And again, this is a much elderly patient, all right, which a lot of people will be probably too afraid to do surgery on because of their age. But through small incisions with great blood flow, they heal very well. So this patient underwent the bone cutting at the head of the metatarsal bone, head neck area. We did the shifting of the bone. We also had to release some of the contractions from the tendon. So we did what we call a lateral release. So we went into the interspace of the joint, and through a small incision, again, very small incision, we're able to conduct what we call a lateral release and release all that ligaments there and release all the tendon that's pulling the toe away and causing the deformity. Once we release that, the big toe becomes extremely flexible, and we're able to do an osteotomy as well at the base of the great toe, which allows the big toe to sit properly. Because after fixing that bunion deformity, that second toe that is pretty much dislocated, we have to do a lot of soft tissue release. Now, again, traditionally, an open surgery, you go in there and you use an instrument called a McLamory, and you're going in there and you're releasing all the capsules and trying to realign the toe and cut all the collateral ligaments. But we're able to do a lot of work just from a small, tiny blade through a small incision where I would do the same release, on both sides and dorsally and some even plantally, and then realign the toe to allow the toe to be able to float in a more plantar flex position, which means downward position. Also, we're able to use just x-rays. This was done in a private office setting. So all of this was done under local anesthesia with the patient awake and talking to you, or sometimes just resting and listening to music. And we're able to use our x-ray to guide us to allow this deformity to be corrected. And you can see the result live. And at the end, as always, we use external bandaging. That external bandaging becomes our external, almost like an external fixator, but it's not a metal. We're just using taping techniques to align and keep our new positions for our toes after the correction. So this particular patient's case with this large crossover toe, large and huge bunion deformity that would be usually, a lot of hardware, a lot of metal plates and screws and everything in there. This patient was able to reduce the deformity without any of that, but just through minimum invasive surgery. So once again, look at the pictures and look at the post-op x-ray of this patient, and also look at the post-op images of this amazing reduction in deformity just through an in-office procedure under local anesthesia with fluoroscopy, guided procedure with no metal hardware, with no tourniquet. And this patient did extremely well and had such a great outcome. And again, with minimum invasive surgery, we can really make a huge difference in the lives of our patients, especially even the ones who are at risk, our elderly patients and our diabetic patients. So I look forward to sharing more images. If you like what you see above, please go ahead and click on our link, give me a thumbs up, and we look forward to the next episode with you. Take care. Bye-bye now.